Okay, so here we have a figure from the Hersel and Corbett paper in 2019, which is an updated model of chronic ankle instability. And this figure illustrates how a chronic ankle instability can develop following an ankle sprain, and then also how multiple factors can interact over time, either exacerbating or alleviating symptoms. So at the top, we start with the initial injury, which is typically going to be an ankle sprain, including or involving the ATFL and CFL ligaments. And what's important, or what this model outlines, is that the injury doesn't just affect the tissue locally; it can trigger a sort of a cascade of neuromuscular and biomechanical changes, which then impact psychological elements throughout the athlete. So in the center, we've got the model highlighting self-organization, meaning that the body is adapting in response to the injury. And these adaptations begin with pathomechanical impairments. And these are things such as joint laxity, movement restrictions, and tissue changes. And these mechanical issues can then influence how our body is sensing and controlling movement. From there, we've got two sort of major categories of impairments. So on the left side, we've got our sensory perceptual impairments, which includes things such as sensation of pain or reduced sensation, whether we have perceived instability, which links to our functional ankle instability, a subcategory of chronic ankle instability, and then also a fear of movement. Okay, so this is essentially outlining things that affect how a person is perceiving their ankle. On the right-hand side, we've got more motor behavioral impairments. So these are things such as muscle weakness or poor balance and altered movement patterns, which ultimately may culminate in reduced physical activity. And these are influencing how a person would move. And then we've essentially got a loop between perception and action, sometimes referred to as neurosignature. So essentially, they both affect one another. So what you feel affects how you move, and how you move will reinforce how you feel. And that's what we need to break, or the cycle we need to break if we've got a negative cycle there as a sports therapist. We've got some personal factors additionally, so we can use this tool from a clinical perspective, as that may affect some of the central factors, equally some of the rehabilitative tools we could use for them. And then at the bottom, we've got our outcomes moving from or spreading from chronic ankle instability on the left-hand side, where hopefully we're going to move up that continuum to being a successful coper. But overall, the model emphasizes that ankle instability isn't just a mechanical problem, it's a result of complex interactions between elements of the body, brain, and also environments.